when you walk away and leave it to the village.
All right,
people
good
to run it.
afternoon, ladies and gentlemen, dear friends. We'd like to start this session also by respecting the online participants so that they don't sit in front of empty screens and have to listen to awful music. So could we close, yes, the doors, please, so that it's not so loud in here. I'd like to welcome you to this session. We thought it was very important to have a session that deals with the digital transformation of health and with a range of issues that are related to the development of new technologies, but also to discuss how can we harness the innovations that have sometimes been made for totally different reasons in other sectors to actually work for health. And in order to do that and to look at the potential for health, but also some of the dangers that we are facing, we have an absolutely fantastic panel here. And I'm thrilled that it's also gender balanced. And actually, we're waiting for one more participant to join us who's just coming over from the World Bank. So just to introduce our speakers first, and of course, only with a few sentences, otherwise we'll be here until tonight. So the first, I'd like to introduce Professor Anurag Agrawal, who is the Dean of Biosciences and Health Research at the Trivedi School of Biosciences at Ashoka University in India. I might add that I've had the great pleasure of working with Anurag for several years. We jointly chaired a Lancet Commission on governing health futures, growing up in a digital world, and some of the issues that we discussed might relate to that. Then next to me is Dr. Neera Gorin. She's the Senior Clinical Lead, Health Information Quality, Google and YouTube. She also has experience with DeepMind before she joined Google. And I thought that was really interesting. She's worked as a resident in relation to children's health. And some of her interests, I think, will also be reflected in that. Then we have Dr. David Novillo Ortiz. He's the Unit Head, Data and Digital Health, Division of Country Health Policy and Systems at the World Health Organization, at the Regional Office for Europe. You already experienced the Regional Director earlier on. And I might add here, he's also the recipient of the Director General Award for Excellence in last year in 2022. Then we have Dr. Olivia Velez. She is Chief Digital Health Officer at IntraHealth International, and she is also the co-chair of the Global Digital Health Network. And joining us, I'll say this straight away, is Ms. Marlies Gorgens. She is the lead digital health flagship research program at the World Bank, and also brings with her experience as having been the lead at the bank for the emergency and preparedness response. So quite a distinguished panel. And I thought, and we had this little discussion earlier on, I would like to start not with me defining what we should be discussing, but with the panelists deciding what they should be discussing and saying, you know, what is really close to your heart? What is the one thing, the one message you want to bring across in relation to the situation we are in now? You know, the deep digital transformation on the one hand, the way it is affecting health and the way it could affect health. And some of you will already have heard this term of the digital determinants of health, that we really have this feeling that this transformation has a lot of significant and different impact. And I think, Neera, this is one of the things that's very close to your heart. So would you start us off?
Yeah, so I think it's important to start off with the why, and I'll start off with the why from the perspective of Google and YouTube and why we care so much about the space, specifically when it comes to information. And that's because information is a determinant of health. And it's a determinant of health that's gained kind of increasing priority, was really highlighted by the COVID-19 pandemic, and is often sits orthogonal to the known social determinants of health, like housing and education, meaning that it can actually have a separate effect to those known social determinants of health. And because information is such an important determinant, because Google and YouTube are major information platforms where the public is coming to get information that's going to inform their health choices, we care very deeply and feel we have an imminent responsibility to cultivate a high quality health information ecosystem. And so much of the work that we've done over the past few years has been around that specific goal, not just from a combating misinformation perspective, but truly in terms of defining and raising up high quality information. And I can talk a bit more about that as we delve into the panel. I'll pass.
Thanks very much, Neera. Let's move to another part of the world. Let's move to India. And Anurag, what's the thing that you would really like to flag? What is important to take into account in this discussion?
I think what's really important has been on my mind is that there is the old good fashioned digital. Sometimes we call it good old fashioned AI. Then there is the new digital, which is all the machine learning and things. In health, India has experimented with both. We find when it comes to conventional digital ways that we understand, successes have been easy to find. But when we start going towards public deployment, whether during the pandemic, whether later, of things that were not built for the population, imported from outside and deployed, things are much, much more complex than they seem to be by reading journal papers. There's one thing I would emphasize is digital has an entire spectrum, and we need to understand what part is ready for deployment and what is still experimental.
Thank you, Anurag. So, David, you indicated, and again in our little pre-discussion, one of the issues that continuously comes up, what is really a key digital determinant of health? You could say either that the digital divide is one of those key determinants. You could also say the divide itself is a driver of many of the ensuing inequities. So David, obviously from yourself, but also from working for WHO, equity is at the center. So would you share some of your thoughts on that, please?
Yeah, thank you so much, Ilona. So, I mean, as we all know, the COVID-19 pandemic accelerated the digitalization of society. And that means that sometimes we are leaving people behind with the digitalization. So as you may know, 34% of the population at the global level, so almost 3 billion population, is still without access to internet. When we are looking at developing countries, only 45% of the population has access to internet. So there is, and this is just a small determinant, right? So we have been conducting research applying the Progress Plus methodology, looking at place of residence, race, religion, etc. And we have found consistent evidence about how the digital divide is clearly when aligned with the determinants of health related to English speakers, young population, urban areas. So the same differences that you can see in health in general, you can also apply to digital health when it's about equity. So I would like just to be a bit provocative and just to throw to you just 5 points that we have in mind and how we can work together to address this important gap. And first, what we have in mind is we need to develop a common framework to really analyze the use and the uptake of digital solutions to close this gap. And that is something that we don't have still proper methodologies in how to do it, right? Also, we need to map inequities in digital infrastructure. So we know when there is electricity, when there is internet, so we should map this to really address this equity in digitalization. Also to collate evidence for effective approaches to address the knowledge, the skills, and confidence using technology, right? Also applying this intersectionality, how we're going to mix race, religion, and all these factors to really understand the digital divide. And finally, also, and for me the most important is how we are going to use inclusive and participatory design approaches, and we really include the population and the health and care workers when developing digital solutions. So these are just some ideas. I'm looking forward to hear from my colleagues, but also from the audience about what else we can do about it. Thank you.
Thanks very much, David. And I move on to Olivia. What is on your mind?
So I have lots of things on my mind, so I'm going to try to keep it narrow. But first and foremost is that we need to better invest in digital public goods. You know, donors, WHO, country governments have invested in this software. We share them with the expectations that they meet the same security and privacy standards that commercial goods meet, that the quality of the data that's captured in those systems meets those same requirements. We're not going to have equity if those systems are substandard, if they're not adaptable to all contexts, and if it's not concomitantly done with job creation for local developers, local data scientists, local analysts who can help adapt those systems to the local context so that they can see success when they're implemented. As a part of that job creation, we also have to think about gender inclusion and equity and who's in the digital health workforce. As someone said earlier today, you know, we can't have equitable health without an equitable workforce, and that is going to be critically important as we move these technologies forward and innovate.
Thank you. So you've heard quite a spectrum that is actually moving forward, back and forward around these digital determinants and the application of the new tools and the new technologies. And of course, as we all know, a technology is a technology, but it depends on how it is applied. And Olivia has also alluded to the fact that we have an enormous gap because of the speed in which a range of these technologies are being developed, the way the algorithms are becoming more and more, how should I call it, knowledgeable, and in the extent to which the governance of this transformation is actually catching up. Could I ask you, Neera, how you see that from a Google perspective? What is the element of the public value and what you also feel should be governed, last not least, in order to have a level playing field between the companies? What are the kinds of governance discussions you are having within the company in relation to the new developments? And I guess what went through my head is that you're just, about to release a large language model around health, possibly in competition to another company. But that would be really interesting. How is that driven forward, and how do you see the governance? Because that has to relate back to a health system that's actually very restrictively governed usually.
So I think it's important to kind of click up a level and just think through, when we think about information quality on our platforms, we use a framework to operationalize the different levers that we need to pull in order to ensure the quality of that information. And that framework is called a 4R framework. So we raise up high quality information, we remove information that's violative, we reduce information that's borderline, and we reward quality content. So when you think about it in that perspective, the policy piece really sits within that remove lever. And then there's a bit of kind of overlap into the reduce lever. Within the remove lever, we have a whole team that work on different policies to determine essentially what is harmful to the public. And that's really, it's this fine balance between ensuring that we are not raising in discoverability harmful content while also retaining free speech. And that's a really fine balance to have, which is why we have this spectrum of different ways that we can ensure that ecosystem is as high quality as possible. When it comes to health information quality, we tend to think around the concepts of consensus and harm, and consensus is difficult because science is dynamic, and so it's consensus with the best available evidence to date. I think with this new advent of LLMs and where that's going, we would still think about, like any technology that we have, we've done a lot of work on the raise side of the world in terms of identifying what is high quality content and how can we raise that up at scale globally in a high quality and non-harmful way. So part of that is democratizing access to information. And I think that when we think about the application of LLMs and other technologies, we will be thinking about it in the same capacity in terms of raising up high quality information, but also ensuring that that information is not harmful. And that's kind of really core to all of our efforts, is that we do not want to raise up harmful information on our platforms. I think that we are at the beginning of a journey. And I can definitely say that in terms of our information ecosystem, and specifically for sensitive areas like health, we will tread carefully and make sure that the information that we're surfacing to the public is as safe as possible.
Thank you. I'll go to WHO then and say, hey guys, are you governing this business? Are you setting standards? Are you protecting the world's population? Are you talking with Google? Are you working with Google? Tell us all.
Good. As you can imagine, this is not prepared, so I will improvise. Okay. So there is an important challenge ahead of us, and WHO has a role in all of this, preparing quality information, but I would also like to drop the ball to our governments, and I would like to ask you a question. You have a symptom, or you don't feel well, are you going to the web page of your Ministry of Health or your Secretary of Health? So evidence says that no, usually you don't go there, not even to WHO, right? So that is actually something that needs to make us think how we can change this paradigm. And I was saying, we need to invest in information. We are not doing that. Let me jump from information to data. 2015, SDGs were adopted, the Sustainable Development Goals, by all the member states, agreed to improve health population and the life of the population, right? So doing that, as of today, the SDGs, 17 goals, composed of 232 indicators, more than a half of them are still not routinely connected. So when we are talking about data and health information, we need to think what we are talking about, right? So we have a lot of challenges ahead of us. WHO has also these challenges, but also WHO relies on the data provided by the governments and the ministries, right? So it's a win-win between all of us. We know that we can continue improving how we manage health information, but it's important that the baseline, that is the data, is also improving. And that is something that when talking about digitalization, we are neglecting in the discussion. We don't talk about data. We just talk about AI, etc. Sorry if I move topics.
I'd like to follow through though. So, you know, some people are saying, and there's work here at the National Academies of Medicine, etc., about using similar processes as one has for health technology assessment for algorithms, for example. And there is this question if health at a digital level, and I'm consciously using this very vague term because we don't even know now all the things that are going to be possible. Is there a standard setting role? If, you know, WHO is the normative organization, WHO sets standards for medicines. Should it be setting standards in this field? Is this being discussed in WHO, or does one say, oops, hot potato?
So in the case of particularly AI, we are working closely with partners, and there is an artificial intelligence partnership in which we are very involved, and we are trying to develop this kind of guidance. The problem, as you can imagine, and we were criticized for that in the past, and we will continue being criticized, is the time that takes us to put things together. We understand the criticism, but also to make things as much quality as possible takes time. And this is very difficult to explain to health workers and to the population that we need time to really deliver safe products. Again, we will be criticized for that, and we will continue. That is something that we cannot do anything about it. Just continue working with everyone, absolutely, and to keep them involved. We listen and we learn. And I know that can sound very politically, but it's true. I have been myself leading COVID-19 response missions on the field in the European region, and you cannot imagine the kind of things that we have seen and we cannot say, right? So just working together, we can really address all the challenges, particularly related to digitalization, and definitely we should have a role. Yeah, sorry, I am responding just with a clear yes.
Yeah, sure. I'm just trying to provoke a little bit whether, at one point, and WHO has worked extensively on infodemics and actually helped create the term. It has worked with the big companies exactly using and supporting you in developing those strategies that, the first information on COVID would be from WHO if somebody clicks it, et cetera, very important cooperations, and there's very active interface. But I'm sort of thinking we have all these things. We have a public health emergency of international concern where one's supposed to work a little bit quicker. And so the issue is, if we are confronted with a field and with a technology that is developing so rapidly, what are the new ways of working? Because the responsibility, both positive and negative, on the one hand, the potential is so large for people. On the other hand, some of the dangers that will come to are also very worrying. So, how can one speed up this governance process also through a new kind of dialogue, probably? That's important. Anurag, India is sort of seen as a leader in this field. I know that India, of course, as many of you know, is the G20 chair right now and has actually put the digital transformation right on top. India was the country that pushed most for the digital health strategy of the World Health Organization and wants some things to change. So Anurag, is there something we can learn from India? Is it right that they're so pushy in this area and say, hey guys, we did it, you can do it too? So tell us more.
So borrowing a bit from what David said, criticism is the only constant in life. There are things to learn, and there are things perhaps not to learn as well. I will start by saying India's digital strategy was never health-centric. If you look at digital health, imagine 4 pillars. Pillar 1, know everybody. Everybody should have an ID, payer, a provider, everything. Pillar 2, insure the people for health insurance digitally. Pillar 3, deliver the services digitally. Pillar 4, make all payments based on the others digitally. Now, if you look at it, Pillar 1 and Pillar 4 have got nothing to do with health. They've got everything to do with economy. Know everybody, make all payments digitally. So if you build Pillar 1 and Pillar 4 first, effectively what you're doing is you're expanding the market massively. And you're hoping the flow of money and the fact people get used to it will help you build Pillar 2 and 3. So I think we've done a fantastic job of Pillar 1, that's called Aadhaar Universal ID. We've done a fantastic job of Pillar 4, which is called Universal Payment Interface, UPI. We have dreamed of a universal health interface modeled after the UPI, so UPI to UHI. Hasn't quite worked because of a variety of considerations. I'll go over some of them. And the pillar of providing insurance to everyone. On paper, it is nice. Poor people have insurance, but people have to accept your insurance before you can get the care, and that still remains challenging. The challenge has been privacy and data, and the fact health data is so different from other data. It was required by the courts of India that anything that you're entitled to, you cannot link to the national ID. So we then had to make a rule, people can have more than one health ID. But the minute you can have more than one health ID, well, the problem that was earlier discussed about the quality of data, knowing everything properly, jumps out of the window. So people have a right to create an ID, share data, not to share data. But in the process of creating multiple IDs, now we don't necessarily know what to do with that. So I think these are challenges that as a democracy, we will all debate, discuss, find the best way. Is data truly something that belongs to the people? Is data something in which you need the concept of solidarity, which was one of the major topics of our Lancet Commission, in which case any way that uses the data while creating minimal possible harm to the people on which it was generated is okay. But that's a social contract. So I think India as a democracy, large one, very large one, a very diverse one with various socioeconomic connotations, is struggling through many of these ideas. And we are also trying to, while this is all what I was saying, good old technology, we're also trying to borrow the latest technologies, artificial intelligence, try to send to villages, see if kids can be weighed by photographs, malnutrition can be found, nutrition interventions can be done, retinopathy can be detected. There I'm saying success has been less, perhaps because most of this kind of work and the models we are buying weren't built on Indians. And perhaps that's where we need to start. But we need to get all this in order before we make progress on the last front. And I'd be happy even if we made progress on the basic digital part.
Thank you. I'd like to go back to Olivia and the issue that you raised about public goods. Also in our Lancet Commission, we were very clear about public value, and also saying if we link digital and universal health coverage, then basically they need to be built on the same value. And we see a big value discrepancy between digital generally, how it's applied, and the UHC values. And particularly, we already raised it, the equity issues, of course, the universality issues, the solidarity issues, as Anurag said. So could you explain to us a little bit more if we speak about digital public goods, which often also includes open source approaches, etc. What is it that you mean? What does it mean for an individual? What does it mean for a government if they go down the road of digital public goods?
Sure. So first, let's acknowledge.
You have to go a little bit further because of the online participants.
Digital public goods are not free, right? You don't pay for a license, but somebody has to maintain that software. If you are relying on college students to do that for you, it's nice, but that's not going to keep your health system in place. And that's not what you want when you're talking about data that people's health is going to impact their lives. It's going to impact UHC. We need to invest in it in the same way that we invest in any other good that we expect to have good quality around. And not have it as an afterthought and patching things and, relying on people's altruism to make it work correctly. And so that's where I see the biggest challenge, because for so long, we were just like, here's $2,000 to keep your software going for another year. And can you imagine, still using Microsoft Front Page to make your websites, how ugly they would be? And why is that the expectation that that's okay for healthcare, to have terrible interfaces? And especially as we're making complicated health decisions as a health worker, right? And I'm looking at a system and it's not helping my cognitive load. It's actually causing more problems. And now I'm making bad health decisions and I'm making healthcare worse. And we see that, these systems actually contribute to mistakes because they're not well designed. They they contribute to health worker burnout, because now I have to learn a system that's difficult to use. Plus, your NGO gave me a phone and your NGO gave me a phone and your NGO, and I'm walking around with 3 cell phones with 20 different apps. None of them talk to each other. I'm spending most of my time re-entering the same demographic information with no unique ID to link them. So you can't do any kind of, epidemiological work on them whatsoever. So it's not sustainable what we're doing. It's piecemeal, and it's not impacting health in the way that it should be. And it needs to be fixed. We are not going to see the gains that digital health and innovation can promise without good base systems, without good data. And we're actually increasing health inequities by not fixing this problem, because the countries that are getting the advantages of AI, of precision medicine, of machine learning are continue to be leap years ahead of the countries that can't even have a basic information system.
So how would we build that? Anurag, what did India do?
I mean, I guess the first part of doing anything is to have a strategy. So what India did was put a strategy in place with the 4 pillars I talked about. What we realized is that while a huge amount of data is generated in the country every day, for almost anything you can imagine, including a rare disease, India is a country where something that's 1 in 1,000 is 1 million people. So we generate a huge amount of data through our healthcare system. We aren't able to capture it properly. And capturing this data properly in a place where a typical patient encounter could be less than 5 minutes is not going to occur through standard electronic health records. Which means if we want to do it, we have to reimagine the entire system of data capture. You have to make it in a way that the health record system is not just recording it, it is helping you make the decisions as you go forward, saving you time, preventing errors. And this is part of a great redesign that is happening right now as we speak. At the moment, we see ourselves as disease rich, data poor, despite being a very big country. We hope by the end we become data rich and disease poor, and focus a lot more on the preventive part of health. And in one particular area where India is investing a lot is on maternal child health. Because there is no way to have a healthier nation over a long period of time than to focus on young women, mothers, and children. And in that particular area, everything you can do using digital to empower a system ranging everything from nutrition to vaccination to follow-up to prediction of premature births, early mortality, that's where the biggest investments are going to be.
Thank you, David. Looking at Europe, and of course, just a reminder for everyone here that we're talking the WHO Europe now, which is 53 countries, I believe, which are very different, and some, many people don't know this, actually very poor. So how many of these countries have digital health strategies? What is the situation there in relation to how Anurag described it for India?
Sure. So thank you so much, Ilona. So we conducted a survey last year about the status of digital health in the WHO European region. And thank you so much, Ilona. I forgot to mention that the European region WHO is composed of 53 countries, nearly 1 billion population, just for you to know. And then Marilis, sorry to interrupt, please join us.
Come up.
Thank you so much.
I keep waiting for her to
I was
walk
also
up.
waving, but yeah, so she's coming.
Yeah, go ahead.
So, and then what we did during this survey, as you can imagine, it was a national survey. So you can imagine the challenges to get responses at the national level to have a full overview. But if we take this as a national response, 44 out of the 53 countries responded that they have a national digital health strategy. With that being said, only 33 of them mentioned that they have some measures to address inequity. And for them, the most cited measures to address inequity were related to improve connectivity, invest on digital literacy and digital health literacy. And I forgot the other two, my apologies, but there was a number of measures that they were referring to inequity. And just to mention about the point that we were talking about India and the importance of data digitalization, I would like also to mention that sometimes what we have seen on the field now in the European region, before in the America region, is that sometimes we digitalize for the sake of digitalizing. And when you digitize a broken data process, in return, you are going to have a digitized broken data process. And we need to know that. We need to fix the data processes, and then we talk about digitalization. And that is something that we are not doing. And that is putting us in the position that we are. That we think that we are growing up and doing well. I have a different opinion about that.
Thank you. And that's, of course, something we're experiencing in general in the health arena, that most countries actually have a broken healthcare system. And by just adding some digital here and some digital there, you are not going to be able to reform your system. And actually, you might make some things incredibly worse, as you indicated. And this is of great concern also, as some of you know, in global health, there are the big discussions on universal health coverage, which will also go to the United Nations. And there's hardly mention of the fact that, the world is in a period of digital transformation and what that would actually mean for the healthcare system. I'd like to ask you, Neera, is there, as you are developing these systems at Google, is there a vision what a future healthcare system could look like?
So I'll take that question and turn it just slightly, which is that we recognize that there's broken digital systems across the world and disconnected systems. But the one thing that is kind of ubiquitous in most places is a cell phone and the ability to go onto Google or go onto YouTube and ask a health question and get information and use that information to make an informed decision, either independently or with your care team. And because of that, when we think about the power that Google has, the power that YouTube has to actually be a positive impact in the healthcare of the global people, we really think about it from an information perspective, because that is really how we're going to reach billions. And so that comes back to, okay, so if we know that people all around the world are accessing health information on our platforms, what is our responsibility? And our responsibility is to make sure that that information is high quality. And when you think about quality, I think this comes back to your question around partnerships and collaborations with external authorities. We believe very much in that. And so when we think about quality and ensuring quality and raising up high quality, we had to ask ourselves, what is quality information? What is that definition? Because that word actually gets thrown around quite a bit. And so we collaborated with the National Academy of Medicine, and they actually convened an expert panel to actually consider the question of what is a credible health source? What does that look like? And they published a paper in the summer of 2021. And we've then taken the definition that the National Academy of Medicine has established and operationalized that at scale in partnership too with the WHO, who globalized that definition, the NHS in the UK, the AOMRC in the UK, and really have taken that and said, okay, how can we now use this globalized definition to scale and raise up high quality content from these credible sources across the world? And we've done that specifically on YouTube by launching products like health shelves, which are essentially carousels at the top. So if you type in a query for one of our top health queries, you will actually see a carousel of videos at the top that are only from sources that have been vetted as credible sources using this definition from NAM and the WHO, et cetera. We also now have labels below each video that say, this is a video from an accredited hospital, or this is a video from a government source, or this is a video now we actually have expanded in the US and Germany to include individual creators. Individual creators and influencers are a key part of the information ecosystem. It is actually where many people around the world are getting their information from. Unfortunately, a lot of that information is not great information. So what we're trying to do is meet people where they are. Where are you getting your information from? And how can we make sure that that information is as high quality as possible? Make sure that it's more discoverable, and also give users the contextual cues to show them that, yes, this is information that you can trust. And I think that with the platforms that we have, which are available to the public for anyone who has internet access and a phone, that is one way that I think Google can play a really big role in this ecosystem in a positive way.
Thank you. That relates also to an issue that has come up as a priority from our Lancet Commission. We worked very closely with young people, and their perspective actually was that this was their health system. and working on, what they then called a digital first health system, meaning access to information, but also access to trusted professionals, et cetera, et cetera. And again, the whole issue of the priority issues, Anurag mentioned some priority issues for Indian community-based healthcare. For them, obviously, the priorities were mental health issues, reliable and trusted information. The other was sexual and reproductive health and rights, issues that normally they couldn't perhaps access in their culture and because of the positions of their government, etc. So I think one of you also indicated it, that a lot of this is related also to the governance environment, how free does information flow in the society in which I live? Does the information I give flow to a company or flow to an autocratic state? We, on the one hand, are critical of information flowing to companies. On the other hand, in other countries, people are highly afraid of any of their information going anywhere near the government. And those governments don't necessarily want companies like yours in their country then. So there is always this larger interface here, what happens with data, who can use it, who makes money off it, and who actually uses it for political repression. I can now welcome Marlies, who's made it, which is wonderful. You've listened a bit to our discussion, Marlies. So just give some commentary and related to the work you're doing on the World Bank in this area.
Sure, that's a nice general question to get started, and I'm sorry for being late, but I was in the back listening to the very interesting discussion. I think there are 3 points, just picking up on the general comments that have been raised. The first one is that I think we are past the era of talking about digitization and digitalization in health. There is definitely an incomplete agenda. As we know, in many countries, we still have paper-based registries with monthly tallying of data that gets captured into a WHS. So digitalization and digitization is important, but I think our focus in the healthcare sector for too long has been exclusively on that equates digital health. If we only had an information system, we could fix everything. And whilst I recognize that particularly in low-income countries, that remains a challenge we have to solve, I think there is a next wave of transformation that's happening that's really tied, not led by technology, but that is led by the transformation that needs to happen in the health sector itself. We have a global flagship program on digital health at the World Bank, and we will be launching a flagship report on digital health at the United Nations later this year. And one of the key themes in that report is this concept that we've really moved from digital health to digital in health. We would argue that there isn't an aspect of health systems management or healthcare delivery or patient access interfacing with their own health and with the healthcare system that doesn't involve digital in some way, shape, or form. So the question before every country, therefore, and that's my third point, the question therefore before every country is not, do I go digital or not? It is of the numbers of different information systems, the distributed information systems that are out there, the pilots and small apps here and there that target a few patients, and of all the digital technologies that are out there that I can use for diabetic retinopathy or detecting a blood pressure bangle to detect gestational diabetes. There are umpteen tools out there that countries can use. The question for countries become, how do I choose what is the most relevant set of technology, and how do I fix the small islands of data problem that so many countries have? And so I think it becomes a matter of understanding as we think about digital in health in our country, where can the technologies and data bring the most value to us as we transform our healthcare system? And I think we have a significant challenge as the global health community, because we have not invested enough time and money and energy into understanding what is value in digital health. Value for a patient, value for a provider, value for the system, value for people who may not otherwise have accessed healthcare. We haven't quantified that, and we haven't done the kinds of evaluations and prioritization that would really enable us to say, in country X, 1, 2, 3, and 4 is the in year 1, and these are the things we're going to focus on in year 2, and here are the things we're going to focus on in year 3. We don't have a good evidence base to be able to make those kinds of decisions. There's this underlying, and it's the only part in healthcare that I've encountered where there is this underlying sense that technology is good and data is good, and we have to go more technological, and we have to go more digital because it will be good. And I'm not suggesting that it won't be good, but it's about how much time and energy are we investing in this or this versus the other things we should be doing. So I think there's a level of prioritization and pragmatism that is needed if we're going to help countries, and we as a global health community are going to move into this next wave of thinking about not whether we do digital, but what digital, in what context, in what ways, as we focus on our ultimate aim, which is health and well-being for the population.
Thank you, and thank you for 2 things. First of all, reminding us of the ultimate aim, which is health and well-being, and we put that right in the center of our Lancet report for young people in this case, obviously, and also reinforcing this point, which is why also in our commission we sort of tried to move away from talking about digital health and kept talking about the digital transformation in health. Meaning that, and at one stage, as one of our young people said, that term is going to disappear. Health is going to be digital. So we're not going to talk about digital health as if it were a technology that we add on.
Yeah.
Anurag, you were going to comment.
Yeah, I mean, I want to extend this point, and maybe the idea of individual health is not usually talked about in global health. But if you think about the current disease-centric models, as the world ages, and here's a sobering number, the average age of dementia is 80. Life expectancy is now crossing 80, which means the majority of people will spend substantial years with reduced mental faculties towards the end of their life. So the only way out is to wellness. And that's where, what we learned a lot in our Lancet Commission. Not because young people are too far away from getting old and diseases, but the reality is they wanted health to be about wellness. And one of the strongest parts about digital is its quantitative measurements. You can have quantitative measurements of wellness. In fact, the only way you will ever define wellness and maintain wellness is by quantitative digital means.
Yeah.
So I think we're at the cusp also of it changing in the meaning of health itself, where we move away from disease, we move towards wellness, we start making measurements much earlier in life, we start charting individual health trajectories, we start noting deviations, and I think that's a completely new vision of health. I mean, it's not easy for me to see how equity would come in this, because the time and money aspects of this are enormous. But if one could calculate long-term benefits, and I have no idea how one would do it, I think this is the real promise of digital in time to come.
You're nodding?
Yeah, no, I completely agree. I think we think about that from an information perspective as well, which is there's health information as aligned with the traditional healthcare system, diagnosis of disease, treatment of disease. And then there is the concept of creating health or wellness. And that, I think, I agree with you that is where the puck is going, and it's where it needs to go. And I think that's both from a care delivery, so not just sick care, but actually creating a healthcare system that creates health, that drives towards wellness. And it's something we're thinking about from an information perspective as well, and how to get more of that type of information, health promotion information, not even just your typical preventative health screeners, et cetera, but true information at a much earlier age for the younger people that you were referring to, because that's really when those actions need to be taken in order to prevent the global burden of NCDs.
Yeah.
Thank you. Olivia, I'd like to go back to you. One of the things I didn't mention when I was introducing you is that you're also a nurse, and that you're very active also in this whole arena of nursing. And one of the things we've sort of discussed about people and them getting their information, etc. But there's an enormous challenge for the healthcare professions. And we were also discussing in the Lancet Commission, when we're saying health of young people, of course, in many, particularly of the low and middle income countries, healthcare professional nurses are very young people as well. And how do we bring that together? What do you know of any excellent examples where people have, said this digital is also an enormous opportunity for a health profession like nursing or caring?
Yeah, so I think there is a lot of promise in that direction, and a lot of things that are happening to bring nurses into the technology space and other frontline health workers, not just as end users of it, but creators of it, right? So how do I help design a tool that really fits the work that I do as a nurse and how I work with patients and interact with patients? So there's SunSeal, which is nurse entrepreneurs and researchers, and it's a society for tools that they're building. Anybody who's worked with nurses knows that we're very innovative. We can, squeeze a lot of juice out of a lemon and make it work. And so that's critically important, but we have to support nurses. We have to support frontline health workers, because we also know on the other end, that bad information systems is the main contributor to health worker burnout right now. And so we need to make sure those tools that are really appropriate. And then to touch on some of the things that Anurag and Marlise said, right? Anurag said, in India, they're disease rich and data poor. And then the next step after that is to be data rich and information poor. So you can have a lot of data. It's not useful. I can't make decisions about it. I can't treat my patients better. So how do we make sure those tools are really helping us understand how to treat our patients and how to really make decisions that are going to affect individual health and population health? I think one of the great promises of AI and machine learning is like, can we really analyze large qualitative data sets, right? Because we know well-being is impacted by society and stress and our lived environment. And that data is very difficult to quantify. You can collect a ton of qualitative data, but what does it mean? So being able to support health workers to get through pages and pages and reams of data to say, this is what's really impacting this patient, and this is why they have all this stress, and this is why they're facing this in the 15 minutes that I have to talk to you, I think has a lot of potential. But we need, again, people from all aspects of the healthcare system and the diversity to really look at it from an intersectional lens.
Thank you. Marlise, when you look at this, and of course, the healthcare system is one of the most hierarchical systems that we have in our societies. And of course, that has all kinds of economic consequences, and also people opting out of the system, etc. In this report that you've been preparing about the digital in health, to what extent are you reflecting how that changes the very nature of the system and the people who work in it?
It's an interesting question, and I think that I think about it in two ways. I think first, how we can think about how technology and data can help us to be more efficient and effective, And I think there is this, again, this sense and this assumption, but if we really investigate it closely, there isn't a lot of empirical evidence where we measure the extent to which technology and data helps us to be more efficient and effective, right? There's the learned experience. People say, if I use this technology, or I have seen, and I hope that this technology is going to help me to be more effective in seeing my patients, or I can see, you know, I think that the area that it varies significantly by the area of healthcare that we're working in. I think in the field of radiology, we can absolutely say that technology is helping radiologists be more effective, because it can screen out the 50% of chest x-rays that is definitely not TB, and leave the radiologist with half the volume of x-rays he or she would previously have needed to look at, to say, in these 50% of x-rays, I need to look at them, but these 50% of x-rays I absolutely don't need to look at. There are other parts of healthcare delivery where the value proposition is less clear or is not yet proven. And typically those are the parts of healthcare delivery that requires more creativity, right? That is less repetitive, where we're repeating the same thing over and over. So if we think about oncology treatments, for example, that's very complex and requires very many different decision points to come together. We haven't yet seen, we know the famous case of the IBM Watson, Dr. Watson, that struggled, right? In when he was training, when Dr. Watson was training at the Brigham Hospital, right? There's a very famous case study about how they struggled to make, and now I've given it a plural because I need to find a pronoun that works for Dr. Watson, right? But those are just examples where I think what we've sometimes tended to do in digital health is imagine the shiniest, biggest, juiciest fruit and start there, instead of just starting with the basics and being really clear about what is the value proposition and how it can really, I mean, I feel we have such a collective responsibility in this era where we are post-pandemic. We have to do pandemic preparedness. We have to bring routine health services back to where they were. We have to reimagine healthcare. We have to think about wellness. I feel like the climate change, I read a report the other day that suggests that 54% of infectious diseases, not just vector-borne, but all infectious diseases, will increase in amplitude and duration because of climate change. So that's just more health that the healthcare sector needs to deliver at a time when there are fewer healthcare workers, an aging population. I feel like the challenges just multiply exponentially for the healthcare sector. And I believe we look to technology and we look to digitization and data as a way to overcome those technologies. But I don't think we've collectively figured that out yet about which technologies in which context can make the biggest difference. And so I think that's where we've really got to put more effort on, because at the end of the day, we have to convince a government that spending $1 on a new digital technology is a better use of that money than maybe buying one more bed net or immunizing one more child, because those are some of the choices that governments have to face. We are in this environment where we have to squeeze that much more value out of every health dollar, every health rupee that is available. And I don't think we have sufficient knowledge yet to say which technologies in which contexts. It feels a little like the Wild West out there, if I can call it that. And I think we've got to bring some pragmatism and some prioritization to this agenda. Else, we don't want to look back at this in 10 years from now and say we spent all this money on technology and data and it didn't bring us the value that we all had on this side of the timeline that we all had hoped that it would be able to achieve.
Thank you. I think this is a very good point to open up the discussion, to have you participate. And I'm not quite sure who's passing around a mic. I think Heather is getting active here. And I'll collect a couple of comments and or questions and then come back to the panel. There's a lady in there, behind you.
Oh, behind me. Hi. Thank you very much. In regards to,
Can
this
you
is for,
introduce yourself?
oh, sorry.
as
Yes,
well?
my name
Thank
is
you.
Leslie Bigden. I work for digital science. My question for the panel is, how do you see SDGs measuring or promoting inequality, global inequality?
Okay, very challenging question. A gentleman here, please. No, just here. Just here. Excuse me, sir, you wanted to say something?
I didn't understand the
Yeah.
question.
Sorry, email came across.
Ah.
Digital distraction.
Yeah, there we go.
Tally, University of Louisville, and also from ScholarX, which is a digital ed tech organization. I have a question because it mentioned a couple. What are the opportunities for, this is more about data standards and data interoperability. So, because I think one speaker talked about having to re-enter data over and over again. So there's organizations like HL7, AHIMA, HIMSS, and so forth. They tend to have most of their memberships in HICs. What are the opportunities to collaborate, get extension into LMICs and whatnot, and get better perspectives and inputs into the data standardization needs, that could potentially address some of the digital divide challenges that you have so eloquently been discussing in the panel?
Thank you for that. There was a lady back there.
Hi, thank you for this great discussion. So Nufar Rosen-Adler, I'm with BD, Becton Dickinson, MedTech and Diagnostics. So one of my questions is very kind of practical also. When you talk about global goods, open source, I know Dr. Olivia mentioned this is not free. So can you better define what the intent here? Because we know countries don't know how to budget for data systems, informatics, all of that. They don't want to pay for it either, but needs to be a cultural and awareness education that they need to start budgeting for this because this is something they receive value for that. BD as a company, we invest a lot of money in investing in software, in patches. Cybersecurity is not discussed about it. So when putting these software in countries today, we need to be smart and intentional, thinking we don't want to then introduce something that can have longer term implications. So do it right today with these longer term thinking in place.
Thank you. We'll take one more here and then I'll go back to the panel.
Thank you all for coming today. My name is Allison Andrews. I'm a first-year medical student at the George Washington University. And as someone who's developing in her career and starting in this field, I was wondering if you would be so bold as to name one technology that you're specifically hopeful for in the development in the future years.
Wow, she stole my closing question for the panel. Thank you for that. All right, let's park that for a minute and move on. David, can you say something to the SDG question that was raised?
Yeah, thank you so much. And as Ilona says, this is a really good question. So sorry, but I'm going to repeat myself. So the first challenge about the SDGs is that we are still not routinely monitoring a half of them. So it's difficult to speak in how this inequity has been closed because we don't have proper data. So we are looking at very old data. So without proper data, it's going to be difficult to see this, right? We saw the Millennial Development Goals, right? And the positive thing about this and the role of technology now is like when we're talking about the Millennial Development Goals, data or digitalization was not even mentioned there. So the SDGs is digitalization everywhere. So hopefully in the next thing that will come, for sure, we can imagine that something will come, that will continue helping. So regretfully right now, and to be quite open and transparent, the challenge that we have in front of us, and maybe because my hat is also trying to coordinate data, is that we need to do much better in data. And maybe I may also to just quickly go to the other questions about opportunities. I think that's something that governments should continue working is to develop, define the standards. So we know about the standards that are available, but the countries should decide what they want and then open the menu. I have at least one good example. I don't want to name any countries, but that they define the standards. This is what we want. Any provider is welcome to work with us using these standards. So I think that the opportunity is also support and continue supporting countries in how they can define the standards, and then any provider can adapt to that. And just about, I don't want to go for the one technology, but for the global goods, I think that the digitalization is in every single speech on every decision maker, right? So all the decision makers are talking about digitalization, the importance of data, but I miss that in the budget. And I think that we need to move from this donor perspective approach that we are using almost at the global level, and we need to invest on data and digital health. Until that paradigm is not solved, we will continue again and again trying to see how we develop global goods. From my point of view, we're still not taking seriously the importance of data digitalization to really transform health.
Thank you. Marilise, could you come in here? Because I think those are things that you've worked on, and thinking about the budgeting, the willingness of countries to invest, and moving away on the one hand from the usual donor approach. On the other hand, of course, we see that countries like China are investing significantly in Africa in digital infrastructures, etc. And of course, one of the bases of this whole thing is to have some connectivity in the first place before you even go anywhere else. So what experiences from your side in terms of this question we had on budgeting, money, investment, and not only from the outside, but the inside?
Yeah, if I had the perfect answer, we wouldn't need, if there was a perfect answer, we wouldn't need to be here to discuss this. I think that first I want to acknowledge that it's a challenge, but I also think that the environment is changing. And we saw during COVID how powerful data was in helping governments with everything from planning information campaigns to vaccine rollout campaigns. And at the bank, we definitely see in our conversation with clients much more of an urgency that we have an opportunity now to invest in digital and to take what we learned during COVID and for the emergency response that needed to be mounted at the time, to take those and convert those digital technologies and data into things that can be used for routine health services. So I found in the past that it was hard to convince governments to even have a conversation about digital and what we finance in digital. But part of this next evolution that I really want to say from, digital health being this fringe thing that a few people are really passionate about, to digital being in every part of healthcare delivery. I think as part of that, there is more of a willingness to invest domestic and international resources. Now, I think in doing so, the question of prioritization is absolutely critical. And that's where we find governments are asking us questions, and I'm sure other partners questions as well. It's a little to your point, right? If there are 500 different technologies and 300 things I need to do, and if I want to bring digital into healthcare delivery, which ones do I do first? How do I best solve this problem in the short, medium, and long term? The second thing I think that we need to be better at, and it gets to your question about the private sector engagement in digital. The business models have not yet well been established. Part of what our digital and health report focuses on is what can we build private-public partnerships? What do private-public partnerships look like for the private sector that both provide technology, but that are also healthcare providers in some countries themselves? How do we better engage in that model? Because for the private and public sectors to work together well, we've learned from our colleagues at the IFC, there are many hurdles that the private sector has to overcome, and we have to ensure that we bridge that gap. And then thirdly, I think we need to just provide the practical tools. I would say it was more difficult in the past, and it's becoming more clear once I've done this prioritization of what I'm going to focus on in the short, medium, and long term, understanding how to do a good budget, understanding what the costs look like, the total cost of operation, both the initial capital investment and then the ongoing operational costs. As we develop more, as more countries implement, and as we collect more of that costing data, that process is becoming more clear, but we definitely need to make sure that as countries, there is this increased interest, we can show the value in terms of efficiency and effectiveness, that we also collectively use all this costing data to make what we are collecting and how we're helping countries be that as efficient as possible.
Thank you. Neera, could you say a word or two about experiences maybe on public-private partnerships here?
Yeah, I mean, I think I'll just refer back to what we discussed before, but the partnerships that we have developed with external partners, external authorities have been absolutely critical to all of the work. They've really unlocked many different products. Really, like what we are trying to do at Google is launch products and product features that help improve the overall user experience for users on our platforms. And specifically in the health sector, in order to do that, there are really key definitions and also key content that we need in order to do so. This was very apparent during the pandemic, where we partnered with key authorities like the WHO in order to populate different information boxes that would pop up when there were certain queries on the platform. And also in terms of definitions, like the definition I mentioned earlier around the credibility of the health source, and really needing to have those definitions not determined in-house. We want those to be determined externally. And published in the literature. And then we use those and operationalize those to unlock different products across our platforms, whether that's on YouTube or search, et cetera. So I think that those are really like the two key areas where from the information side of our platforms that the partnerships are really critical, which is, you know, content partnerships, actually developing the content that would go into different products like our knowledge panels, that the WHO has been a part of, and also product partnerships where there is some kind of rate limiting piece of information, usually some type of definition that we need to be developed, and then we can use that to operationalize a product at scale.
Thank you. Anurag, one of the questions was more or less directly.
Yeah, absolutely. So, I mean, I'll first answer that question regarding standards from the point of view of India, then get on to a more general one. In India, the issue has never been standards. The standards are common. In fact, many of the people who built the EMRs and deployed probably were working in one of the Silicon cities of India. In fact, the second mover advantage came into play, that the government mandated that anybody building an EMR solution has to follow a certain set of standards. The challenge is, how do you get a standard EMR vision that came from the US, built around billing primarily, into a country where the point was not medical records, the point was a health management system, where a physician in an outpatient clinic of maybe 3 hours sees 100 patients. To get the clinicians to adopt, it had to be more than a recording system. It had to be something that helps the workflow. And because India has a lot of out-of-pocket healthcare, there were enough situations where small companies could create products which are now coming out. So for example, for non-communicable diseases, from the very first protocol they're implementing, from the first 2 words that you type, almost the rest of everything could get filled in, and you would simply say, check, 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 check. Even the devices as you go home could be integrated into such a way that the values of your blood pressure device or your glucose device would show up into the same EMR when you show up to the doctor's office. This is where we are at in the innovation cycle, driven primarily by smaller companies creating customized products to accelerate workflows, allow more to be done in a shorter amount of time, targeted as of now primarily to out-of-pocket healthcare, not insurance-based. Wherever there is insurance-based healthcare, there is always a distortion of what you are doing the records for. In the end, we're going to have to blend these two. And for other countries that don't have a natural strong IT base and are still struggling with these issues, what you're saying is absolutely correct. Fix the standards, focus on interoperability, have it as part of the digital health strategy that people can't just develop EMRs. A minimum set of guidelines must be in place. Then introduce a lot of these things as digital public goods. Let the smaller companies come into play and create innovation for the local ecosystem. And I think good things will happen.
Would you see it like that, Olivia?
Yeah, I think so. I think, yeah, sorry. So within the digital kind of public goods movement, there is a pretty active FHIR community. So I think there is drive and people behind getting those structural standards into place. I think, the next level of challenges, right? Like the smaller tools, the smaller entrepreneurs, they may not have the cost margins to do what it takes to develop their tools with those kind of standards. And I think we also just have to acknowledge that the standards that we have are imperfect, right? They're not great. Some are better than others. And like you said, a lot of them are focused around billing. Or if you look at, I think it was Loink, right? So Loincad, this is you're allergic to peanut butter, you're allergic to peanut brittle, you're allergic to peanut butter chips. I mean, if you're allergic to peanuts, you're allergic to peanuts, right? Like it doesn't need that level of detail. So I think there's just problems in that area that also just continue to be, well, that the great example for you then. So I think we need to also continue to work on those kind of challenges, especially when we're talking about systems that are going to be used in a cross-cultural, cross-national context, because then there's changes in all those kind of places. So yeah.
Thanks for that. There's time for one or two more questions. Does anybody? Yes, please go ahead straight away.
Hi, I'm Rubayat from Bangladesh. I'm a tech entrepreneur. I've been in health for about 15 years now. So I was just thinking back to what was said in the panel about the need to localize and really understand the local context and adapt technologies to the needs of the context. And I'm just referring back to a couple of experiences from my past organizations. One where, for example, we had to work with the government for 10 years to gradually build capacity, demonstrate evidence, and then roll out a system for digitizing the health workforce and creating patient management records that currently serves about 100 million people. So that's kind of one success story, but it took 10 years. And then there's also a failure of trying to do telemedicine with rural pharmacies for 3 years, and then realizing that there was no way it was going to get to scale, right? But then both of these experiences needs to be learned from and disseminated properly so that others can take those learnings and then adapt to their context, right? I think the entire innovation ecosystem, like the question, I guess, is how do we build better knowledge management in this space so that we can learn from the failures and the successes at the same time?
Thank you. Is there one more question, or otherwise we'll move? I don't see anyone. So yes, how do we do that? Does the World Bank do something like that, Marlies?
So we have started with our flagship program a humble attempt to start to collect these experiences through a standard methodology of collecting. So good quality implementation research, where we have a standard method through which we collect these kinds of evidence and getting it out there. I think we also need partnerships with journals like the Global Health Science and Practice and other journals. There's Lancet Digital Health that I know is really looking at what kinds of evidence. But I think before that, we need the standards of evidence. We just published earlier this week a new World Bank working paper on a framework for understanding value in digital health. How do we establish that value framework? How do we quantify what that value looks like? Because I think until we've done that and we have the experiences and people are actively recording them, it really is sometimes you know, whoever sits before the government first with their technology, that tends to be the technology that is used. And we don't have enough data, evidence, information to be able to understand value and to make value-based decisions on technology. So there are also other organizations that are doing that, but I think we need a lot more rigor in this space. Else it feels like a race to technology as opposed to a race to better healthcare. And it's really the latter that I think we're all agreeing we want to be striving for.
David, how does WHO do that with sharing experiences?
Yeah, thank you so much, Ilona. So just in the last year, I think that WHO has tried to produce very high quality scientific research in different topics, including infodemics, artificial intelligence, telemedicine, just looking at what is available. Okay, so overviews or systematic reviews, just to synthesize, because sometimes we don't do that, about what is available. So I think that also our colleagues from the Pan American Health Organization, and we have Sebastian, that is the director for digital health here in the Americas, they're also producing guidance and collecting this evidence. But also in response to your question, I think that there is something that, apart from producing evidence, apart from developing research, something that we are not doing is to share the failures. We are terrified of sharing the failures. And if there is an area of work in which sharing the failures is super important, is the digitalization of health systems. So that is something that we should talk more openly without blaming anyone. And we are so terrified because we are investing a lot that nobody would like to talk about it. So we are getting there in terms of making our member states and governments to be open about this, because that will contribute for the global good that we have been referring.
I'll just add a few things into it. I'm reading between the lines, and I'm seeing the problem that we see in India, at least. Anything done with public money cannot fail, because then you have wasted public money. Therefore, by definition, all public money projects are successes and must be counted at so at the time of accounting to the comptroller, accountant general, or somebody like that. The private sector, on the other hand, is very willing to count its failures, transmit the knowledge, and move on with a particular idea. It's something that I have seen over the last few years. The government become very cognizant of in India. So rather than having only government people and government projects sitting down, and the idea is sometimes as simple that I'm seeing huge WhatsApp groups being created with local tech entrepreneurs, part of them. Every time an idea comes out, we will do it like this. One of them gets up and bashes the idea, saying, we tried this, it failed. Very low tech, simple WhatsApp groups. But the basic idea that private entrepreneurs are more likely to tell the truth in many of these areas has, at least in India, taken root, and their voices are being heard, although by, as far as I know at my level, low-tech knowledge, because we find this is more inclusive than trying to create meetings to which they may or may not fly down.
We actually face an additional problem, and that is the fact that the healthcare system does not have a failure culture. I can see your hand, yes. That the healthcare system does not have a culture of failure. And if then, sort of 2-3 different non-working systems of admitting failure come together, then the failure can be really large. And I think this is a real threat in terms of the digital development of health systems, because then even the question gets even more difficult to blame someone, and it really gets quite difficult. So I think we're close to the end of our panel, as I have been signaled, and I do want each of you, we have 5 minutes, really answer the question we had earlier, but literally just naming that, what is the one technology? We've discussed all around technologies, and we've made the point, yeah, technology should not drive the system. Health should drive the system. So if you keep that in mind, if health should drive the system, what one technology do you think can make the difference or excites you very much at this stage? Olivia.
So I touched on before, I'm really excited about how we can use natural language processing and AI to do qualitative research, and particularly for researchers in the global south to have better access to data sets so they can answer clinical questions and impact the healthcare of their communities in a way that's really gatekept for them right now. Because they're not in a Northern Ivy Tower University. I think that is going to democratize healthcare research, and I'm really excited about that.
Thank you. Neera.
I would build upon that. I think that large language models are something that we're excited about, but we're also cautious about. I think that it's very important to think through the risk benefit analysis for the application of LLMs in any capacity, but particularly when it comes to a sensitive area like health, where there is real risk of harm. So I think that there are a lot of different applications where we could see them have huge benefit in terms of the quality of information that is democratized and made accessible to people around the world. But I think that we have to tread carefully.
Thank you, Anurag.
I'm most enthusiastic about the idea of wearables and health data collected from a very young age when people are well, and the power of models like transformers in terms of extracting meaningful information out of them to define states of perturbation from wellness that will be truly preventive in preventing decline of health.
David?
So my heart is thinking that we should invest more in health workforce, but I'm going to keep the technology and I will be old school. And I think that we are not using enough telemedicine, and not because the technology is not ready, it's because the regulation is not ready. And it's a shame that in 2023, we can still not share this knowledge about health workers due to legal issues, right? Because the main problem, one of the main problems that healthcare is going to face in the 10 years is the shortage of health workers. And telemedicine can definitely support and help on that.
Thank you. And Marilise.
So since I have the last word, I have two and I can't choose between them. On the high tech front, digital therapeutics. I think using technology for mental health services, for pain management, there's a whole type of solutions to healthcare problems that are coming that I think has significant leapfrog potential. Think about mental health services and how inaccessible they are in low-income countries. So I think digital therapeutics has huge potential. On the other hand, I just want to go to my next doctor's visit and I have my little data pod and tell my doctor, here's all my health data of the last X number of years of my life, and not have to fill out another form and another patient portal. Wouldn't we all have, because there are 6 versions of me, of the 6 doctors I've visited in the last 6 years. And sometimes I'm a little lazy and I don't fill in the whole patient history, right? And if we can just solve that problem and have everybody in their health data go during their life from place to place whenever they need healthcare, and their wearable data, there's the soil quality of the place where they live, all that data is recorded, that would be fantastic.
So I noticed that this last point touched nearly everyone in the room and built on everyone's experience. Exactly. And I think therefore it is probably quite an important and central one. I want to give a big thank you to this panel. I think a lot of important issues were raised and discussed. Some solutions were put forward. Some areas openly named where we don't have any solutions yet. We also referred back to the issue of speed, that we are driven. We're driven by technology, and therefore we must take care that we don't lose the ultimate goal in health and healthcare out of our vision. And that was clearly said, that is and remains people's health and well-being. And that perhaps is the most important message for any kind of technological development in this field. So I hope you got some ideas from this that would help you continue your work in a more digital way. And thank you